Let us discuss about cancer chemotherapy. Cancer chemotherapy means the use of drug for the treatment of diseases caused by pathologic microorganisms, parasites and tumor cells. A chemical substance or a drug which is used to kill the microorganism and the cancer cell, it is called chemotherapy. The objective of the chemotherapy might be drugs with high toxicity will be used to kill the cancer cells and less toxic to the host. Coming to the history of chemotherapy, Paul Ehrlich, who was the father of chemotherapy, given rise to a new branch of medicine, chemotherapy. He also applied stains to cells and tissues for study of their functions. He reported the acid-fast nature of tubercle bacillus. Also, he discovered the magic bullet, which is a derivative of arsenic, called as salvarsan, which is capable of destroying the spirochetes of syphilis. Then coming to the goals of chemotherapy, it is mainly have three goals. The first one is curative intention. Though cure may be the goal, it does not always work out that way because cure is possible when the cancer is identified earlier. Next is control. To shrink or to reduce any cancerous tumors, reduce the size of any cancerous tumors or stop the cancer from growing and spreading is the second goal of chemotherapy. Third goal is when the cancer is an advanced stage, the drug may be used to relieve the symptoms and that will improve the quality of life, but we cannot treat the disease itself. Next is the principles of cancer chemotherapy. The ultimate goal is cure. If cure is not attainable, the goal will be palliation. So for cure, early diagnosis and institution for treatment is a must. Drug therapy is the balance between the toxic effect of drugs and their efficacy. Next is the combination therapy, which is more effective than a single drug therapy, which means when we use two or more drugs as a combination, the effect of the therapy will be more. Then usage of intermittent regimens. Adjuvant and neoadjuvant chemotherapy can be used simultaneously. Next is the indications of cancer chemotherapy. When there is a systemic or metastatic disease that is chemo-responsive, while the local control which is not adequate, like surgery or radiation therapy is not adequate, then we will go for a chemotherapy. When the cure rate is very rare, we can choose a chemotherapy to reduce the symptoms. Then when there is a remission or prolonged stable disease are likely to occur for months to years, we will choose a chemotherapy. Then about neoadjuvant therapy. Here we are using chemotherapy to reduce the size of the large localized tumor prior to the surgery. Then when there is a dirty borders in the localized tumor, when the borders are not confirmed, then we will go for a chemotherapy. Then the last one is to prolong the life while maintaining the quality of life, which is nothing else than palliative therapy. These are the indications of cancer chemotherapy.